This is Caring for Kids on News Talk 760 WJR. Presented by the Children's Foundation. And here's your host, President and CEO of the Children's Foundation, Larry Burns.
Well, thanks, Mark. Hello, everyone, and welcome to Caring for Kids, April edition. Happy spring to everybody. On tonight's show, we'll have three wonderful guests, all doing work that supports youth and families. Joining us will be Joe Desch, chairman of the Western Golf Association and leader of the Evans Scholars Foundation. Anthony Muller, vice president of Substance Use Disorder Services at Samaritas. And Bob Burns, executive director of Free Bikes for Kids. It's all coming up next on Caring for Kids, right here on the great voice of the Great Lakes, WJR.
It's Caring for Kids with Larry Burns.
So welcome back, everyone. Larry Burns here, Caring for Kids, April edition. Happy spring to everybody. And in this part of the country, when you think spring, you think golf. And so with me is Joe Desch. Joe is the chairman of the Western Golf Association and leader of the Evans Scholars Foundation. Joe, welcome to Caring for Kids. And tell our listeners about the Western Golf Association and then a little bit about the Evans Scholars Foundation as well.
I will. Thank you, Larry, and thank you for the opportunity to speak to your listeners about this great opportunity. The Western Golf Association has supported the Evans Scholar Program through the Evans Scholars Foundation since 1930.
Wow.
It's known as one of golf's favorite charities, largest scholarship program for caddies in the country. It's a full housing and tuition college grant offered to golf caddies, but that are fantastic students and have significant financial needs. Right now, we have 1,070 caddies enrolled at 21 universities across the nation as Evans Scholars, and more than 11,500 caddies have graduated as Evans Scholars.
Awesome. So a lot going on. And as chairman of the Western Golf Association, Joe, what are some of your major responsibilities and key initiatives?
Larry, this is a critical time for our nationwide growth. Specifically, the plans for me, kind of my focus for the next 2 years is increasing the number of Evans Scholars in school to 1,500 by 2030 and doubling the number of youth caddy opportunities nationwide. And that's why we're really spending a lot of time in the East, the West, and the Southeast, where year-round opportunities are there for caddies, but traditionally in the year-round places, they're adult caddies.
Right.
And we're really trying to introduce youth caddies into a lot of programs and having great success with it as people understand and hear our story. We're also entering the final year of our Promise campaign, which is a comprehensive, very ambitious fundraising campaign. But when you get to the right people and you tell this great story, we've exceeded our goals, and it's really setting us up for some great momentum. And we can't say enough about the generosity of our alumni, our supporters, and the record-setting contributions from all of our championships.
Yeah, well, congratulations. And one of the things I want to make sure our listeners know is, as WJR is heard in more than 10 states, and this is also a podcast, so it's more than just Detroit, it's more than Michigan. But can you talk a little bit about the Evans Scholar presence in Michigan and the Detroit area? Now, I'm a member at Country Club of Detroit. Evans Scholars is a big part of our culture, caddy program. I've lived in Toledo, Inverness. It's a big part of the caddy program. But I know our listeners would like to know the universities in Michigan that have Evans Scholars and a little bit about the Michigan presence, if you don't mind.
Absolutely. And you're asking the chairman, which is a 2-year volunteer position, but I'm from Ohio. So a lot of times we're not allowed to talk Michigan and Ohio because of that rivalry.
Right.
But
You can on this show. You can on this show.
And I'm going to tell you, I'm very proud of the success of the program in Michigan. It's the second largest state in our footprint. The scholarship in the Western Golf was started in Chicago, but Michigan is a big part of our success and a big part of the future. We have 57 kids in school currently at Michigan. We have 88 enrolled at Michigan State. And part of that ambitions plan that I talked about earlier is to increase the number of scholars in school by 2030. So we've developed the Detroit Caddy Pipeline Program to build long-lasting relationships with Detroit-based to identify, train, and place qualified youth in summer caddy programs. The goal of this pipeline program is to recruit, right now, small, but, we're changing lives one at a time.
Right.
But we want to recruit 12 youth in the pilot year and maintain a minimum of 9 youth in the second year and continue to do that over and over. And we have partnerships with schools and local organizations who focus on the equal opportunities for those underserved youth. And as we solidify those, the goal is for a steady pipeline of ninth graders that 3 years later after caddying, and it's the greatest job you can get, I believe. And by the senior year, they can hopefully, if everything is lined up with grades and still the financial need and their great character, they can apply for a Evans scholarship. And it continues at the expectation, as the pipeline from Detroit will exceed 30 students in 9 years, which would be fantastic for not only the universities that they can go to in Michigan, but some of the other partner universities we have nationally that now are giving in-state tuition to out-of-state students. Currently, we have more than 80 kids in our 1,070 that are in school that come directly from Detroit-based clubs. So that's, again, one of the largest cities that is providing our Evans scholars in these opportunities. And we're really excited to not announce, but we're building right now plans to open a WJ Caddy Academy within the next 2 years at the University of Michigan. And the Caddy Academy is an overnight program where students live together in community for 7 weeks in the summer. It's kind of patterned after what we started in Chicago at the Caddy Academy, which really takes kids who were recruiting or who are applying from places across the country that don't have caddy programs anywhere near them. And so we're bringing them to Chicago and have them caddy there. We want to do the same thing in Michigan, where if you're not near a local caddy program, but you could still come to our Michigan Caddy Academy and hopefully learn the same valuable lessons you learn on a golf course, meet role models, participate in activities that in high school, ACT prep and how to build a resume and how to apply to colleges, that we're taking this pipeline of kids from economically under-resourced backgrounds, if you want to call it that, and building them toward an Evans scholarship. We really think this is really important because we've had great success with 90 kids since 2012 come from these caddy academies.
That's great. We're talking with Joe Desch, who is the chairman of the Western Golf Association. We're talking not only about the Western Golf Association, but the Evans Scholars. So I was introduced to this new program that you just mentioned by my friend Clark Standish, a member at the Country Club. And then he introduced me to Jackie Evans, one of your great staff people and also a great golfer, by the way. And
Absolutely.
yeah, and the Children's Foundation now has a focus area on youth development. We also run the First Tee in Greater Detroit, so we're excited about that. And then when I started talking to Clark and Jackie about this new program that you mentioned in partnership with the University of Michigan during the summer weeks, it really seemed to me to fit into what we're doing for underserved kids who maybe don't know golf, but certainly with the right mentorship can evolve, can become a caddy, and maybe become an Evans Scholar. And so we just made a grant to the Western Golf Association in that regard. So can you tell our listeners a little bit about that grant?
Absolutely. And thank you for your generosity. Your gift to the Caddy program pipeline will allow us to dedicate additional resources to Detroit and strategically recruit potential Evans Scholar candidates to Caddy programs around the area. Ultimately, this pipeline will allow us to continually increase the number of underserved and high-achieving youth who are not always exposed to golf. And so many times that I'm meeting, we have scholarships to give in some ways because of caddy programs eroding or kids finding different jobs. But these opportunities, when they're not exposed to golf, when they get to this opportunity, it is such a great pipeline to a life-changing Evans Scholarship. And so your gift to this Detroit pipeline is going to be transformative, I believe, when we look back 5 years from now and say, wow, we exposed golf to so many more kids who would never have this opportunity.
Yeah, absolutely. And that's one of the reasons we're super excited about starting this relationship and then continuing it. I'd like to connect First Tee Greater Detroit to the program. As these kids grow older, they become caddies and then go to college. And I have seen in my golfing career, and I'm not a good golfer, but I golf, so many caddies learn about my business and nonprofits. They ask people who are financial consultants, lawyers, and they learn so much. They make these connections, as you mentioned, Joe.
Oh, absolutely. And it really is the first stage of some of these people who have never networked with these kind of individuals. And, our program has 36,000 passionate supporters. I want to develop the next group of youth, just like I was as a kid who learned so many things from being out there on the golf course that changed my life in many ways of how I did business and things like that. And as I am allowed to sneak over the border into Michigan and I've seen some of these selection meetings and seen the people from Cass Tech and Cristo Ray and kids that are really looking for the opportunity. They're driven to find the opportunity. We're just a nice matchup with all these great programs in Michigan that could expose these kids to great opportunities for school in the future.
Yeah.
And ultimately, we are a program that is caddies to college to careers. And not only do we get you to college, now we develop you in college to get your first career, and then an alumni network that probably will get you your second and third career down the road because of you're an Evans Scholar for life in that regard.
Yeah, well, that's so powerful. So, Joe, thank you so much for what you're doing as a volunteer for the Western Golf Association, the Evans Scholar program. We look forward to working with you to develop this new program in Detroit, and come and visit sometime. We'd love to see you.
Larry, thank you so much for the opportunity, and thank you for all the generosity of all the people in Michigan to continue this program. Thank you.
Well, it's certainly my pleasure, and thank you. And coming up next, we're going to talk with Anthony Muller of Samaritas when Caring for Kids continues here on the great voice of the Great Lakes, WJR.
Welcome back to Caring for Kids on WJR, presented by the Children's Foundation.
Welcome back, everyone. Larry Burns here, Caring for Kids. I am now joined by Anthony Muller. Anthony is the Vice President of Substance Use Disorder Services at Samaritas, one of our partners at the Children's Foundation. So, Anthony, tell us about the exciting things going on at Samaritas. I know that you have so many good things going on, so can you highlight a few of those?
No, sounds wonderful. Thanks for having me on.
You're welcome.
There are a lot of things going on right now, so I'll highlight a few of them, and I'll probably save the substance use part for the end. But we were awarded last week a contract for the state, which goes for 3 years for trauma assessments, and we have been doing that service for 4 or 5 years, but they just rebid that out, and we were going to be able to begin doing work in Southeast Michigan as well. So we doubled our size starting June 1 for our trauma assessment. So that's kind of a really exciting thing. It's such a needed service for individuals, and just to be able to provide that and to have the state recognize the expertise that the team has been pretty gratifying.
Is that in schools, or how do you reach the kids that you're interviewing?
Sure. These are referrals from Department of Health and Human Services for individuals who are in the abuse neglect system, who they see some signs and symptoms. And so the tool it's a very comprehensive assessment. And at the end of it, what we're really looking for is not just diagnosis, but also for recommendations. So
right.
I need to think of some of the people who've gone through a lot of difficult things, being able to provide some insight, a lot of measurable tools, and some recommendations to help them have the best opportunity to repair.
Yeah, and we're talking with Anthony Muller from Samaritas. Well, you hit a great point. It's one thing realizing that a youngster's gone through trauma, but it's another thing to figure out what to do for that person. And so that's an extremely important part of that. And what other new things or exciting things you have going on across the state or in the Detroit area?
Yep. So real quickly across the state, we are opening a clinic in partnership with the CMH in Ionia County called The Right Door. and we are opening that up on the 25th of this month, so less than 2 weeks away.
Good.
Have our staffing and everything lined up. Going to be very helpful for that community, and we're doing some growth across the state and mental health, getting some psychiatry, some additional psychiatry going on. Looking at the southeast side, we are really excited. We are up and running in Oakland County with our adolescent outpatient, and really looking at even building an intensive outpatient program for substance use disorder there. So outpatient is, the American Society for Addiction Medicine has different levels of care. So outpatient is generally, it's 1 to 5 hours a week for adolescents, and normally that's where you have individual counseling, maybe some family counseling, an hour or two a week. And then the intensive outpatient program is something that is anywhere from 6 to, the way the ASAM, American Society for Addiction Medicine, has it, it's a 2.1 level, and it's 6 to 19 hours. But traditionally, it's 3 days a week, 3 hours a day of group counseling, and then some individual and family counseling as well. So we have staffing in place. We are getting some referrals in for the outpatient side. We're doing a lot of outreach, and we have a curriculum put together for the IOP when we have enough referrals for that.
And what would be the age groupings for that type of outpatient care?
So outpatient, the individual, we're really looking at primarily focusing on adolescents, which of course nowadays kind of extends all the way up into the mid-20s based on different definitions. Yep. The group for the intensive outpatient program, we're really focusing on school-aged individuals, so maybe 8th grade, but 9th grade all the way. And so you might be 19 and still be in high school, or you might have just graduated, and there's a big difference between a 15, 18, even a 19-year-old and a 40-year-old. So a lot of the intensive outpatient programs are adult programs. There's very few adolescent ones. Right. So if you're 19 years old, you would probably be very well served in an adolescent intensive outpatient program.
Yeah, it makes perfect sense to me. So since we're now talking about the substance use disorder services that you provide, what are some of the things that you and your colleagues are seeing in the adolescent and young adult populations? And how has COVID impacted this group? That's really important for us to try to understand.
I mean, one of the biggest things that has been an epiphany to our leadership team is just the increase in vaping, and kind of where does that fall on the continuum of care of services? Because it used to be, so I've been in the field for 25 years, and, cigarettes, and obviously those were concerns, but we never focused treatment so much around that. The vaping epidemic has really cause so many more individuals to use, and then when you start vaping, you don't always know what it is you're vaping, and the ability to vape a marijuana product as well has been pretty significant. So we actually have created and actually have up and running in Oakland County, Grand Rapids area, and also near Lansing, we have a vaping group that is set up for individuals. So this is kind of like the early end of the continuum, and we really kind of take the philosophy of what controls my will, and looking at, because there's not research that's been out for 40 years on vaping. A lot of adolescents don't see that as an issue, but it's also one of the first times where there's something many adolescents are doing that they know they shouldn't do, that they're being told they shouldn't do. There's part of them that knows they shouldn't do it, and yet they really struggle stopping because of the addictive. It's such a fast delivery system. You smoke, it gets right into your lungs. So that's been a huge thing, and we've actually responded to that by actually creating vaping, and it's not classes, it's a treatment program. It's an outpatient treatment program.
Great. And for those of us that are a bit older, and so smoking a joint, historically was pretty obvious if someone was out parking lot smoking a joint. But this is a question. The vaping, it could be a marijuana product, and you would never know it, right? If you walk by, or is that accurate?
That is accurate. Yeah. So, marijuana, a joint, such a strong smell.
Right.
The smell, but with vaping, someone could be smoking marijuana in a vape in school, and if they can blow out like they could nicotine, and no one sees the cloud that's there, they're not going to have any idea of what's going on.
Yeah, that is frightening.
It is.
Yeah, so kudos to you for having that vaping initiative. And sort of on that same frame, this show is heard by a lot of people, mostly adults, so mom, dad, along with grandparents. What advice, Anthony, do you have if someone feels as if their adolescent or older child or grandchild is experiencing either a trend that might lead to substance use disorder or certainly are already there. What advice do you have for people listening that may be concerned?
No, I think that makes sense. I think the first thing is just that awareness, like you said, already concerned. So even for individuals who aren't concerned, just to know that it's a potential, know that it happens to families across all ethnicities, across all socioeconomic class, so just being aware it's a possibility. If you're concerned about something, it's worth having a conversation with your adolescent or grandchild. One thing that I recommend, and I actually do, I have 4 boys. I have a 19-year-old who I don't do this with anymore. I have a 16-year-old. He goes into the pediatrician every year for his physical. And as a parent, I asked the pediatrician to do a drug of abuse screen. They're getting urine for all kinds of things. My son doesn't even know I'm doing that. I have 2 11-year-olds, so I'm not doing that yet with them.
Right.
But if there's concerns, then you probably ought to follow your gut to find out if there's anything behind that. Because there are ways. There's all kinds of testing and things to know. I think it's easier to come back and say, okay, I had this concern because of this, but nothing's going on, versus, 2 years later where this problem, this maybe wasn't even a problem at the time, but it has progressed, and that's substance use disorder. It is a progressive disease, and so the earlier we can intervene, the better. And if there's nothing going on, then fantastic. But like I said, a nice little trick I do, and I just recommend, is you got that yearly thing. Kids aren't thinking about it. It's just a little bit of a peace of mind sometimes for people.
Yeah. Well, we recently, as you know, because you were there at our behavioral health summit, one of the speakers said, if you think there's something wrong, there probably is. Mm-hmm. So be a bit more invasive than what some of us have been in the future. If everything's fine, great. But if it isn't, then at least you've taken the action to try to help the situation. So that's great advice. And so we're talking with Anthony Muller from Samaritas. And the Children's Foundation recently made a grant to your organization. Can you tell our listeners about that grant?
Yeah, no, it's such a blessing. And so really it ties in with the Oakland County work that we talked about, how we have an outpatient clinic working on the intensive outpatient program for adolescents. Adolescent substance use, unfortunately, there aren't a lot of options for individuals, not a lot of places that specialize. There's lots of reasons why, but it's something where we've seen, it's been a passion of mine. Like I said, I've been in the field for 25 years. It's probably, if you said, what's your core passion for substance use treatment? That's where I cut my teeth in adolescence. I had 15 years as doing clinical work. So you have given us the ability to get started, because nothing is easy to get started. Right. So we have to go out and reach out, and so we're very excited that it is up and running in Troy.
That's awesome. We're delighted to help, and we look forward to continuing that relationship. So someone asked me recently, is there a trend for younger kids to become either addicted or using drugs? And so what are you seeing out there from kids getting started?
Yeah, so obviously we see the kids that we see are people who have been involved with substance use. So it's not, thankfully, it's not a perfect part of society, but we see adolescents who are starting to use a lot of times 12, 13, 14. There's some that come to us, they started later, but it is not uncommon for us to see a 15 or 16-year-old who has been using for a couple years. Rarely do we see someone in treatment within the first 6 months of when they start using. Often it is, because normally if they get caught that early and there's an active intervention, then they often don't need any type of treatment, or at least not any intensive treatment. So we are seeing a lot of young people who struggle with substance use at an early age.
Yeah, well, that's what I heard. So unfortunately, that's accurate. So I appreciate all the great work that you're doing at Samaritas. The Children's Foundation is delighted to be partnering with you on that. And Anthony, I want to thank you for your many decades of service, and appreciate being on Caring for Kids.
Wonderful. Thanks for having me.
Yep, you're most welcome. That was Anthony Muller from Samaritas. Coming up next, we're going to talk to one of our other partners, and that is Bob Barnes of Free Bikes for Kids. When Caring for Kids continues here on the great voice of the Great Lakes, WJR.
Welcome back to Caring for Kids on WJR. Presented by the Children's Foundation. Once again, here's Larry Burns.
Welcome back, everyone. Larry Burns here, April edition of Caring for Kids. With me in the studio is Bob Barnes of Free Bikes for Kids, a partner of the Children's Foundation. Bob is the executive director of Free Bikes for Kids, and he actually rode his bike here from Brother Rice, where he teaches. And so how was the journey?
The journey was wonderful. Anytime I'm on a bike, I love it.
That's awesome.
Beautiful weather. It was great.
That is. Do you ride your bike to school a lot too?
Every day, summer and winter. Yeah.
Winter?
Much. Winter too. You bet. Yep.
Oh, my. That's awesome. So tell our listeners about Free Bikes for Kids.
Well, first of all, thanks, Larry, for letting me join you today. This is a wonderful opportunity, and I appreciate a chance to talk a little bit about what we do. So Free Bikes for Kids, basically, it's a very simple premise. We collect used bikes from the public one day a year on a big event in the fall, and we bring them to a donated warehouse space, and with the help of thousands of volunteers, we fix those bikes up, and we give them to kids right before the holidays.
That's super.
It's no more complicated than that. There's a lot of little side benefits to it, but the obvious one is giving kids that chance to experience the joy and the freedom of a bicycle that almost everyone can remember. When you ask them, do you remember your first bike or the first one you remember? Yeah. People have very fond memories of that, and we want to give that experience to kids that are underserved and maybe have not had that experience. But on a bigger scale, it's about a healthy lifestyle and improving not just physical health, but I think mental health as well by getting out and the free play time and just being able to ride around.
Yeah, well, that's so important. Am I correct in remembering, did you need to find a new warehouse recently?
We did. Yes, you are correct. So the model that we operate on is kind of a high volume, low cost model.
Right.
So we can get a bike into the hands of a child with a new helmet for under $30.
Okay.
And the way we are able to keep our costs down is we operate seasonally. So we're only operating 3 months a year. And under those conditions, we can find people usually that are willing to donate warehouse space for 3 months. People can't donate warehouse space to you if you're doing this year round, year in and year out.
Right.
But with a seasonal kind of approach, we're able to get warehouse space. And we had space in the Paquette Avenue building from the platform at 411 Paquette right next to the Henry Ford Museum for 3 years, courtesy of the platform.
That's our Children's Foundation landlord.
That's
the Fisher Building.
So many interconnections, right? But they were very generous and donated that space 3 years in a row for us. And then they decided they were going to develop it. And we were kind of outgrowing it because we had started to collect so many bikes that we needed a little more space. And we had a connection on Vinnie Johnson's board, the Piston Group.
Yep.
And they were very gracious, and he allowed us to use a space on Michigan Avenue in Corktown, kind of Corktown, Mexican Town area. And it's almost 30,000 square feet. And so that's where we are.
Yeah, and I think I know that because Greg Bokart, who's one of our volunteers on what we call Leaders for Kids, I think was a connection with Vinnie.
Got it.
And so that's why I knew that. So I'm always trying to help make
wonderful
connections.
Oh, man.
And that.
It's been great.
So we talked about where you're located. I'm talking with Bob Barnes from Free Bikes for Kids. Is there a need for bikes and is there a need for volunteers?
Yes to both, but conditionally because we are seasonal.
Right.
So right now I would say in April, no. In October, yes, with 3 exclamation points after it. Because we're seasonal, we'll collect our bikes this year on the first Saturday in October. So I think it's October 1st this year.
Okay.
And Home Depot has been our sponsor the last couple of years. So Home Depot stores have opened their parking lots to people to drop off bikes. We'll put those details on our website as we get closer. But in the fall, we will ask people to donate bikes at whatever collection locations we have available to us. And we will need hundreds, really over 1,000 or 2,000 volunteers at that time as well.
Wow.
And folks we had about 1,500, almost 1,600 volunteers last year to get 2,400 bikes in the hands of kids. And we hope to do 4,000 bikes next year. So we'll probably need 2,500 volunteers to make that happen. And come about mid-September on our website, you'll be able to sign up for a 3-hour shift.
Okay. So I'm not very handy. And so what does a volunteer need to be capable of doing?
That's a great question. So we have a position for everyone. Right. So once you get on our website and you click on one button that says volunteer, it asks you 2 questions. And the first question would be, have you ever changed a bike tire? If you're not handy and you say no, it says, congratulations, you're a cleaner.
Okay.
So the folks that come into our building that don't have any hands-on experience with bikes, they can still clean bikes. Because
Right.
every one of those, we collected 2,800 bikes to give away 2,400 last year. It has to be cleaned before
Right.
we give it away.
Right.
We want it to look shiny for the
Right.
child, as nice as it could be. So we've got the cleaner position. Let's say you answered that question, yes, I've changed a bike tire. The second question is, have you ever adjusted a derailleur or a bottom bracket? And most people are going to say no to that.
Yeah.
But they've said yes to the first question.
Right.
So they're this mid-level person which
Right.
can change tires. We call them preppers.
Okay.
And those folks can change bike tires and get the bike ready for the expert who's answered yes to both of those questions, and that's the mechanic. And so the mechanic now is our most sought-after volunteer because they have the skills of being able to take a bike that is still a good bike but needs a lot of TLC and getting it right back up to where a child can ride it.
So I assume you put new chains and things, new parts that when needed.
You bet. Yeah,
So-
all the above.
So here's a crazy question. And if you don't know the percentage, you can make it up. Of all the volunteers, percentage, how many are that last category, that expert?
The mechanics, we probably have about 20%, which is not bad. You know, we're kind of blessed. Free Bikes for Kids is a national organization. And so Detroit is one of several affiliates. And the fact that we exist in Detroit with the big three, there's a lot of engineers and a lot of
like
tech
yourself
type people, right? So we probably have a higher percentage of mechanics than a lot of our other affiliates in other cities. So this was born in Minneapolis, by the way, the whole project.
Okay.
And that's the land of Target and big retailers, so maybe not as many engineers and mechanics there.
So that's awesome. So has the pandemic impacted what you're able to do and kids being able to ride their bike, and how has the pandemic impacted Bike for Kids?
Another good question, because it obviously had a big impact as it had on everything that we do, in work and outside of work. But in 2020, when it was really at its height, we had a board meeting and tried to decide if we were even going to have a season in 2020. And we came to the conclusion that, the community that we're serving in Detroit was really hardest hit by the pandemic. And we felt duty bound to respond to that and to figure out how to make it happen, which we did. So we had a season in 2020. We had our workstations were all isolated in our space. We had a big space and put workstations well away from each other, and then a lot of Mylar separating individual workstations, and limited the number of volunteers we had in the building at any one time, and put big industrial fans in for airflow and mask requirements and hand sanitizing and everything that we've come used to the last few years. And probably the biggest challenge was the volunteer pool, because we kind of rely on corporate volunteers and teams of corporate volunteers that we've had from Stellantis, FCA at the time, and Rocket Mortgage and General Motors and Ford have all sent us large numbers of volunteers. And they were not coming as corporate groups in 2020. There was no requirement for them to volunteer, as the corporations kind of relieved that requirement. And so we were way down on our volunteers, but the community still came together, and we managed to get almost 1,600 bikes into the hands of kids that year. So probably if you asked me over the 4 years that we've been operating, what are we most proud of, I would have to say 2020.
Okay.
Even though it was fewer bikes than we've gotten out in both 2019 and 2021, it was the biggest challenge.
You were resilient.
I think it was important.
Yeah. And did you see any impact of kids like having to stay home so they couldn't ride a bike because their parents were fearful if they went outside they'd get sick, or was there any of that?
Yes. And I say that, but also at the same time, if you remember, one of the few things we could do when we were all in lockdown was to go outside and walk around or ride. And there was a big bike boom at the time.
Right.
And so we definitely saw kids that had, significant stress on their lives from being isolated, not just from school, but from their friends, even at home, because they were isolated in trying to social distance and not being able to go out. But biking was one of the few things they could actually still do. So that was kind of a part of the discussion we had in wanting to make sure we had a season in 2020, was to be able to get those bikes out to the kids to be able to do one of the few things they could do.
Yeah, wonderful.
Yeah.
I remember now that people who were trying to buy bikes, new bikes, they couldn't find them.
No.
because there was a shortage because it was, as you mentioned, it was so popular. So earlier on, I mentioned that the Children's Foundation is a partner with Bike for Kids. And can you tell our listeners about that partnership?
Well, the Children's Foundation has been just an incredible partner. I don't even know how to overstate that. And I'm very serious and genuine in saying that because in the last 3 years, Children's Foundation has literally enabled us to execute our mission with the donations and the grants that you have provided for free bikes for kids.
Right.
So to give you an idea, the last 2 years, Children's Foundation has been our largest benefactor to keep our mission going. And especially in 2020, when things were difficult, it meant the difference between us being able to execute the mission and not being able to execute the mission. But it helps us to fund the big expenses that we have. And our biggest expense is contract labor to pay for our bike mechanics that make sure the bikes are safe for the kids. You know, we have volunteers throughout the process that get us to a bike that's been volunteer repaired. Right. Now you got to have a bike mechanic say that the work the volunteer did is good. And so your grant has allowed us to fund those positions, keep the bikes safe, to get them in the hands of kids. Bike parts. So our number one expense as far as the bicycle itself goes is the parts that we need to buy. You mentioned chains earlier, tires, brake parts, all kinds of cables and housing for the cables. We had the parts to fix it because of your grant. And then also some supplies as well, because we have a lot of supplies, cleaning supplies for getting those bikes clean. We have a lot of Simple Green that goes into that, and steel wool and rags and gloves, et cetera.
Yeah, I would think so.
So it really has meant the world. And part of that, too, I think, is that as organizations, I see so much overlap in our missions. The outreach to the community to improve the healthy lifestyle for a child.
Right.
And that's really what our goal is, and I think the Children's Foundation has the same goal.
We do. So nutrition and wellness is a big focus of ours. We just created a new focus area called youth development.
Okay.
So we fund a number of organizations that use a sport or activity as sort of the magnet to get a child interested, and then they're teaching them life skills. And those life skills could be resilience, it could be nutrition, it could be exercise. And so we fund organizations like Rack It Up Detroit, uses squash of all things. Horsepower Detroit uses horses to teach kids about resilience and things of that nature. And then we also now run First Tee Greater Detroit. And so Bikes for Kids, I think, falls into the nutrition and wellness side, but also the youth development. And so it's a natural partner, and we are delighted to be helping, and we look forward to seeing you continue to do great work. So,
well, thank you.
Bob, thank you for all you're doing. It sounds like you have multiple things on your plate as a teacher at Brother Rice and as the executive director of Bike for Kids.
Well, thank you so much, Larry. Thank you for the support of the Children's Foundation. It's meant the world to us at Free Bikes for Kids. And thank you for letting me sit down with you and just talk about it for a little bit.
Our pleasure. Look forward to doing more of it. And thank you. That's Bob Barnes from Bike for Kids. And I'll be right back with some information about some cool things going on at the Children's Foundation. So stay tuned. Welcome back, everybody. That was a great show. April edition, Caring for Kids. A few things about the Children's Foundation, a few updates. Earlier this month, we hosted our Child and Adolescent Behavioral Health Summit. We had more than 250 attendees. It was a great day at the Inn at St. John's. We were back in person, which was awesome to be back in person after a couple years. Thank you to all of our sponsors and to those that attended. We are looking forward to next year's summit, so stay tuned. Also, a reminder, the tickets are on sale for our 6th annual Derby for Kids party. The party is at the Country Club of Detroit. Great venue. It's on May 7th, the first Saturday of May. It's a great day of live entertainment, wonderful auction items, fun for everyone, mint juleps, great food. You can wear your favorite Derby outfit. So the best part of it is that it's now raising funds for an important new project that will provide support for adolescents and young adults dealing with substance use disorder. So stay tuned about that in the next few months. And to get tickets for Derby for Kids, simply go to yourchildrensfoundation.org for more information. Thanks for joining us tonight. Thanks for your support. And we look forward to staying in touch. And we'll see you next month.
Caring for Kids with Larry Burns on WJR has been presented by the Children's Foundation.